Greetings from Citizen Health and the Team Academy IAPS and Me Connect. And today, in the series of People's Health It Matters, again we have Dr. Sachin V Desai, who is Associate Professor in Department of Community Medicine, SN Medical College, Bagalkot, Karnataka. A very warm welcome to you, sir, on behalf of all the audience.
Thank you.
And I'm very happy to share that today's topic is nutrition in elder. So, with your permission, I would like to start the session with my first question: that what are the factors which influence nutritional inadequacy in elder people, sir?
So aging is universal to everyone, and then there are few physiological factors which are evident in an elderly, which affect the nutritional status totally at the as an outcome. So reduced taste, reduced smell, regarding the dysregulation of satiety, decreased gastric emptying, then decreased gastric acid, that's your HCl, then also variety of other factors like lack of teeth, that is dentition, difficulty in swallowing, diseases like cancers, COPD, diabetes, thyroid diseases can lead to obstruction of the oropharynx. Thus, intake of food is reduced. So there are also other factors like medications like diuretics, antihypertensives, dopamine agonists, antidepressants, antibiotics, and antihistaminics, which affect the nutritional status. Then also alcoholism, dementia are other factors which can affect current nutritional status of an elderly. So there are also social factors like sociological factors like decline in the instrumental activities where they are unable to shop the food because of the slowness in the activities in the muscle movement. Also, the other factors like decline in the income because of after retirement, that they will not be able to get the best of the foods. Then low socioeconomic status can also affect the total food intake. So healthy food and optimum food will be difficult to take if they are belonging to a lower socioeconomic status.
So, if we talk about the specific changes in aging, like if what about if we talk about the specifically psychological and physiological changes in aging? Could you please elaborate it, sir?
So anxiety, depression, loneliness are a few factors which affect the elderly uh, because of being alone in the urban housing. Then also emotionally, they are not able to share much if they are living in a nuclear family. Then certain grief, loss of their spouse can also lead to certain psychological issues, which can lead to decreased intake of the nutrition of food.
And what about if we talk about pathological changes?
Yeah, so the pathological changes include unable to swallow food because of drugs or because of certain conditions like cancers, COPD, diabetes, and thyroid disorders. So these can lead to decreased intake or absorption of the food.
Sir, how are social can affect in aging? Like, what are the social factors in aging?
So the social aspects I just mentioned, it includes the migration of the individuals to the nuclear families, staying alone while having food, not unable to or unable to uh, uh, share or uh, the togetherness when they are having their food like a joint family that we would have together when there is a joint family. So all these are the social factors which can lead to decreased food intake and then thus nutritional deficiencies.
Okay, so without wasting any more time, I would like to ask about the diet for the elder people. Where to start, sir? From where to start? Like, what are the diet which is required for the elder patient or the elder person? Or if we start with the dietary fats and oil, please elaborate it, sir.
If we have to think about the fats and oils, what we have to do is we'll have to uh, keep different types of oils. For example, one is it may be linseed, it may be soya bean, it may be sunflower. So there are different types of oils that we commonly use. In North, there is also gingerly oil, which is commonly used. This is for the warmth that they use. So based on the region where the elderly are residing, the different type of oil would be beneficial. Sunflower oil is universal. The one that would generate more heat would be used in the northern regions. In the southern regions, the one which is not much saturated would be used. So mixing the oils is important. Not taking only one type of oil is the key. So that's one factor, and then also hydrogenated or dalda. These are certain components which they would use in making sweets, which shouldn't be used ideally because of the type of the fat that is present in this type of oils. And
I I hope so. Digestion is not a problem for the oil and fats, other than the
no,
unsaturated
more
oil.
more than the digestive factor, it's the predominant the cholesterol levels that begin to affect in the vessels. This can lead to cardiovascular diseases in those who are chronically hypertensive or those who are having all the risk factors, like eating more salt and not following DASH diet details. So if a food uh, is more rich in butter, in ghee, and in all the fat foods, then and the vegetable oils also, it can lead to increase in the cholesterol levels.
Okay, we have heard a lot about antioxidant also. Sir, could you please tell us that what is the role of antioxidant and what is RDA for the elderly people?
Yeah. First, I would like to mention what is recommended dietary allowances. So that is the RDA. So every person would have to have a certain amount of calories per day. Okay, for if it's an adult male who is doing sedentary work, he'll have to have 2320 kilocalories of carbohydrates and one gram per kg body weight. So if a person weighs 60 kgs, he will have to have 60 grams of protein. So now in the modern day, it is around zero point 0.8 and zero point 0.9 for men and zero point 0.8 for women. So per kg body weight. Okay, so that will be somewhere around 54, 55 or 58 grams if he's a 60 kg person. So that's the protein requirement. Then RDA would also vary if it's a sedentary worker or a heavy worker. So if a person is sedentary worker, he'll be 2320. If he's a moderate worker, working more than 5 to 8 hours for 5 to 6 days a week, then he of heavy moderate work, then he will be uh, have to consume 2420. Okay, that's the kilocalories. When we make the diet chart from breakfast, lunch, snack, and dinner, the total calories that we consume should account to the number of 2320 in a sedentary, 2420 in a moderate worker, and a heavy worker it is 2820. Okay, kilocalories. So the total food, when you add up to that much amount of calories, it should give. So that is for a moderate worker and a sedentary worker, also heavy worker. So the different occupations which account for sedentary worker, for a moderate worker, and a heavy worker. So, like I just told you, working 5 days a week and more than 5 hours would account for moderate worker. Occupations include carpenters, then weavers, would be doing muscular activity to burn that calories. So others are also who heavy workers include those who are working on the field in the agriculturists, then masons, and then or those who are doing heavy work with the industrial equipment. So like that. So for them, more calories are required and more proteins are required, along with other B complex and vitamins. Okay, so that's essential.
Okay, and what about antioxidants, sir?
Yeah. So antioxidants are selenium, zinc. These are micronutrients as well, and those antioxidants prevent morbidities like cancers. They detoxify toxins, drugs, carcinogens, and mutagens. So they also reduce the levels of cholesterol, which will help in long living and longevity. So they also prevent damage to the brain. They include broccoli, then they include cherry tomatoes, onion, capsicum, red wine. So these are a few antioxidants which are used day in and day out. Turmeric is also another one, and green leafy vegetables, which and green tea. These are a few which you consume day in and day out, which can be a rich source of antioxidants.
Okay, sir, we have heard about DASH diet. Could you please elaborate it for us?
Yes, dash diet is one where there's it's known as dietary approach to stop hypertension. So a dash diet includes sodium, which is less. So ideally, sodium will be less, potassium will be high. There will be more of green leafy vegetables. There will be more of fruits and grains, ideally. So, salt intake should be less than 5 grams per day. Potassium should be more than the sodium intake. Green leafy vegetables should also be there and fruits. So this is dash diet. If a person who is hypertensive follows this diet, then elevation of blood pressure because of sodium will be reduced. So potassium rich foods consume, if they consume more, they will not have elevated blood pressure in the long run, preventing cardiovascular events.
Okay, sir, if we want to know that what are we doing as a doctor, what are we doing for the society for this, or can we take any lesson from any other country for a betterment?
Huh. So lessons from Japan are the ideal most because the kind of food that they eat is very light in calories, but still uh, energy rich. So it's non-fat content, and then it's a dash diet. Plus, it is intermediate glycemic index. Like the sugars are not elevated to maximum when they eat the complete meal. So ideally, they will eat 80%, 75 to 80% of the stomach hunger. So that's the one of the method which is followed in the Japanese, which can lead to uh, so eating stomach full would lead to lots of combustion and then burps. So these will lead to
Right.
so ideally eat 80% of the food, the stomach full, and then eating dash diet and eating a intermediate glycemic index foods are ideal.
In the last moment, sir, before leaving this session, I would like to ask just for a moment, just for a minute, that if you explain in a minute that what is balanced diet.
So balance that, eating the right food at the right time and in the right quantity. So are required. This will complete the diet.
Thank you so much, sir. Thank you so much for having a session with us. Thank you so much for having a talk with us. Thank you so much, sir. I hope that we
Yeah,
will come again on this platform soon with a new topic. Thank you so much, sir. Good day.
yeah.